Kids Camp Pediatric is their family. I feel a sense of belonging, like not only are my children cared for, but I am also cared for.
Even though they have other patients, they treat you like you're the only patient they have, and it's how a doctor should treat their patients.
Kids Camp Pediatrics is like a fun, loving, caring environment for kids and families. Your medical home is the place where that provider knows you better than anybody else and where you can get as many of the services that you need. That's why we have physical therapy here, occupational therapy, mental health. So it's really trying to be a base for that child.
When you walk in here, you see smiles, and it's warm and inviting, and you feel welcome here.
Whether it's just emotional support, or if it's medical treatment, or if it's referral to a specialist, if it's help with financial concerns, related to your health care, she's willing to do it all.
Most of our families are struggling. They're the working poor. And everybody works, they just don't get paid very well. And then in addition, children who have any kind of severe disability get CAP services, and if you get CAP services, then you also have Medicaid. So we work closely with Wake Forest, and we pull children with chronic illness, medical fragility, school and mental health issues from 6 rural counties in the area.
If Kids Camp Pediatrics wasn't here, I really don't know what my family care would look like, and I really don't want to know what it would look like.
The practice overall is about 80% Medicaid. We usually are between 80 and 85% Medicaid, and most practices limit their Medicaid to less than 30% because it pays poorly. Not limiting Medicaid limits the amount of money that we have coming in. And we really want to be able to get a facility where we can better serve our families. We really want to expand in some important ways. So one thing, we'd like to add physical therapy, and in particular we'd like to have a therapy pool. We'd like to be able to have swings and adaptive equipment, things like that, so that these kids can actually get a chance to play. We also would like to be able to do more support groups and parenting classes, so we'd like to have a better facility for that. The ability to have this better structured environment and these things that we can't do here is just going to take the level of the care that we give even, one step higher.
You're not just investing in a facility, you're investing in the community and in individual families, and these children.
You bring in your kids and they look after them like they're their own. They care for them, and it's not just inside the building that they care for them, they also care for them outside. And it's a wonderful thing.
For the last 8 years, we've been doing everything we can to serve the kids in this community, but we can't do it alone. We need your help so that we can keep doing what we do and do it even better.